Welcome to Theory of Pets. I'm a passionate pet owner with a drive to help others like me uncover the truth about the pet industry and what goes on behind the scenes. Hey guys, welcome back to Theory of Pets. My name is Samantha and I am back again this week with another great show for you. If you guys are new to Theory of Pets, my goal here is just to dive into everything in the pet industry that I can get my hands on and talk to experts in the field and find out everything that I can so that we as a community of pet owners can be more informed about the decisions that we're making for our pets. I really highly encourage you guys to leave comments and questions and get involved. If you have something that you've been wondering or trying to figure out yourself, I'd be happy to jump in and reach out to some of my contacts and help you with that. So you can jump on our site, which is theoryofpets.com, and leave some comments or questions there. I might use those on future podcasts, or I might take your ideas and like I said, use some of my contacts to get the answers to some of your questions. So this week, I actually working for Top Dog Tips because I'm the editor-in-chief there. I came across a new, or I guess it's new for canines, but it's actually been around for cats for quite some time. I came across this medication, and the company, it's called t-cyte. It's t-cyte. And so basically, in like the 1980s, there was this huge race to find a cure for HIV and AIDS. And of course, that pandemic's been going on and the research continues. And that's gotten a lot of publicity in recent years. So a lot of medical scientists were using feline leukemia, that virus, and feline immunodeficiency virus. So, as like research models for the human disease. And out of all of this research came this new medication. It's been being used with felines now for 9 years with great results. Dr. Terry Beardsley is a graduate researcher who specializes in immunology at Baylor College of Medicine. And Dr. Beardsley and I had a conversation, and that's what I'm going to share with you today to learn a little bit more about the product, because now, about a year ago, they started using the same product. It has a protein, LTCI protein, that is what seems to be helping the felines, and they found that same protein can be very beneficial for dog to treat osteoarthritis in dogs. So now for about a year, they've been using it with dogs, and the findings are just unbelievable. And when this came across my desk, I thought, I need to educate pet parents about this because it's something that I had never heard of. And, arthritis is such a common thing in dogs, and, feline leukemia as well. It's not as common, but it's certainly something that isn't unheard of. So if you have an animal that's suffering with this, or just something to keep in the back of your mind, because if you're going to be a pet owner long term, and have multiple pets over the years, chances are you're going to get a dog or a cat affected with one of these diseases. And it's something that you should certainly talk to your veterinarian about. It is new. Like I said, for the dogs, it's only been around for about a year, but for felines, it's been being used for about 9 years. And I think the thing that blows my mind the most, because we've had dogs in the past who suffered with arthritis, and the treatments for that, they take supplements every day, or they go into the vet and they're, getting treatments all the time. And what they're finding with LTCI is that it's an injection. It's the injections in the beginning are a little bit more rigorous, and you might do a couple of injections in a few week time span. But then once you get away from that, and the time passes, you can do these like booster shots every few months, or maybe as Dr. Beardsley going to mention in our interview, they'd like to get to the point where maybe every 6 months you can do these like booster shots, and that's it. And you could help your dog. Obviously, feline leukemia, very serious, and canine osteoarthritis, something that just causes your dog so much pain and suffering. They're not comfortable when they're walking. They're not comfortable when they're laying down and sleeping. So if you can do something to relieve some of that pain with just one shot every 6 months, that's to me just unbelievable. Our dogs are our family members, and you want treatments for them that's going to be as easy, as pain-free as possible. So I was really interested in this. I wanted to learn a little bit more about it, and thankfully for me, Dr. Terry Beardsley was able to talk with me. He's obviously one of the scientists that have worked really closely with this product and continues to work on, they're always doing more research and more testing. So he's continuing to work on that, and I was able to speak with him. So I'm going to go ahead and let you guys listen to that interview. Could you just start out by giving me a little bit of your background and kind of how you got involved?
Yes, I received my doctorate at Baylor College of Medicine Graduate School, and I studied congenital immune deficiency, and that was the subject of my doctoral thesis, particularly focusing on bone marrow transplantation. And then I moved to the University of California, Los Angeles, to do a postdoctoral fellowship in nuclear medicine and radiation biology. And that's where I discovered this protein. We were actually working on another project trying to figure out how retroviruses induced leukemia. And in the process, we found this protein. And I sort of put that aside because we were, as I said, looking at how retroviruses affect the ability of the immune system to respond and cause immune deficiency.
Mm-hmm.
But then I moved down to the University of California, San Diego, and started focusing on this protein, what it was, and how it functioned. And that led to a couple of seminal publications in the 80s. Those are on our website in PDF, downloadable PDF. And it really described the protein and its effect on the immune system. And then I left academia and went to work for a big pharmaceutical company. This work sort of sat on the shelf for a while. And then I started the forerunner of t-cyte therapeutics in the 90s, where we actually, our parent company, SL Biosciences, was focusing on the ability of this protein to affect immune deficiency disease. And we used feline leukemia and feline immune deficiency virus in cats as a model for human AIDS. That culminated in the approval that we received for treating those two diseases in cats. So that's been our focus for most of t-cyte therapeutics history. And then we really serendipitously found that this protein not only can increase immune reactivity against foreign infectious agents, but it can dampen immune responses to self-antigens. And we had some clues about it years ago when I was first studying the protein, but we really didn't understand the mechanism. We didn't know about regulatory T cells at that time. And then we had done a study several years ago looking at the ability of lymphocyte T cell immunomodulator to improve immunity against influenza. We actually did that study with a major laboratory over in the United Kingdom. And one of the curious results was the ability of LTCI to suppress the influx of immune cells into the respiratory tract within 48 hours, actually 24 to 48 hours. And that's too soon for an immune response to occur. So we, again, didn't quite understand how that was happening. And so again, that observation sat on the shelf for a few years. And then through some findings in other studies, we realized that this protein could dampen these autoimmune type responses. And we decided to look at arthritis. And the gold standard model for arthritis is a rodent model where you induce arthritis by injecting them with foreign collagen, and it causes arthritis in their hind feet. And again, it's a model for rheumatoid arthritis, and it's used to test all promising biologics and drugs to treat rheumatoid arthritis. So we did experiments using that model, and it was a remarkable response. The swelling and pain in the hind foot was reduced within 72 hours of the first injection of LTCI.
Wow.
So after we documented the effect in this gold standard model for testing agents in rheumatoid arthritis, we evaluated, okay, where can we apply this? And my first thought, of course, was arthritis in dogs and my rheumatoid arthritis in dogs. And my veterinary associate said, well, why not target osteoarthritis? And my immediate response was what I learned in graduate school over the years, as did most people in medical research. Well, osteoarthritis is a different disease. It's caused by wear and tear. It's an age-related degenerative disease of the joint. But I did what most researchers do, and I went to the literature, and lo and behold, I found dozens of papers over the last 10 years, and going back actually 20 years, that suggested that osteoarthritis was an immune-mediated process similar to rheumatoid arthritis. And that data has accumulated and accelerated to the understanding now that osteoarthritis is caused by an immune-mediated process similar to the same process that occurs in rheumatoid arthritis. The same chronically activated immune cells can be found in synovial fluid in osteoarthritis patients, both dogs and humans, as is found in rheumatoid arthritis. So the idea is whether the joint is breached by a viral or bacterial infection, which has long been thought to be the trigger for rheumatoid arthritis, or there is physical injury that damages the joint. Once the immune system can gain access to joint tissue, this chronic immune-activated destruction can occur. So we went ahead and we did the study with a prominent orthopedic veterinarian in Kansas City, double-blind, placebo-controlled study, so none of the practitioners knew which dogs were getting the treatment and which dogs were in the placebo group. And we also used the objective force plate analysis, which is to put a dog on a platform and measure the pressure that's exerted by the affected limb before treatment and after treatment. And the results were absolutely remarkable. And again, that data is published by the group that did the study, and that paper is in downloadable PDF. And the treatment dogs showed an average 40+% improvement in mobility based on the force plate analysis, and the placebo dogs as a group had a -17% decrease in function. And again, we had a remarkable result, and we submitted that data for approval, and as I said, received that approval last November. Now it is conditional. The USDA has that provision in their regulations that if you've proven safety, purity, potency, and a reasonable expectation of efficacy based on the data, you have a conditional approval while you're continuing to do studies to show unequivocally that the product is efficacious.
I see.
So that's really the thumbnail sketch of how we discovered the ability of LTCI to dampen these immune-mediated processes and receive the approval. And the feedback that we're getting now from the field, from veterinarians and dog owners whose dogs have been treated, is confirming the study results. Significant improvement in mobility after the first or second injection.
That's amazing. That's really amazing. I know we've had dogs in the past that have suffered with arthritis, and that's obviously a very common condition in canines. So to have relief that quickly is just unbelievable. I think as a pet parent, when your dog is suffering and uncomfortable, it's finding something that will work, and sometimes these treatments take months and months to show decent results for your dog to actually seem more comfortable. So for something to work that quickly is just unbelievable.
No, it's been remarkable, and I've been doing research for 40 plus years, and this is one of the most striking results that I've seen. And I've seen it in my own 10-year-old Rottweiler who developed osteoarthritis in his right front leg after having been bit by a rattlesnake. And this is a 125-pound dog that could hardly go out to relieve himself, and now he begs to go on a 3 or 4 mile walk every afternoon and evening when we get home. So that is what I've seen with my own arthritic dog. So we're excited about it. We think that it provides another arrow in the quiver for veterinarians in dogs that either don't respond to the existing non-steroidal anti-inflammatory drugs or they're intolerant to those drugs.
Yeah, absolutely. That's just amazing. Now, for pet parents that say their dog or their cat, you had touched on too that LTCI has been shown to treat feline leukemia as well. So if they have a cat or a dog that's suffering with one of these conditions, and they go into their vet's office, and because this is a newer released treatment, what should they talk to their vet about or ask about?
Well, I would encourage them to either download the information and print it out and take it to their veterinarian, or encourage their veterinarian to give us a call, and I'm more than happy to talk with them, explain the product, how it works, and answer any of their questions. And I think the most important aspect of this is that these studies have been done by other people outside our four walls, and the double-blind placebo-controlled study was done by others not affiliated with the company. They used the gold standard force plate analysis, which again is totally objective, and none of the veterinarians involved in the study knew which dogs were receiving the treatment or the placebo. And so the code was only broken once I received the force plate analysis data. And so I think that validates the finding even further. Again, Dr. Jones is a highly respected orthopedic vet in Kansas City, and I would even encourage veterinarians to give him a call if they have any questions, or any of the other co-authors on the paper, because again, these are the people that did the study. I'm not a veterinarian, and so I defer any questions to any of those people.
Sure, of course. And one of the things when we talk about, kind of the safety of it and making sure that all the studies are accountable and things. Speaking of safety, that's a concern for a lot of pet parents, and especially with a newer product, any kind of product, I think, but specifically something that's, veterinarian use and something that's on the medical end. People are always concerned about safety. Are there any side effects? Are you finding any, drawbacks, I guess, after the animals are injected?
No, this is a very well-tolerated product. It is a naturally occurring protein that is normally found in the serum of people and animals. It does diminish with age or in certain disease states. So we've only had 3 adverse event reports in first approved for feline leukemia and feline immune deficiency virus disease. None of those was determined to be due to LTCI. And safety is the number one criterion for the USDA in approval of any products. And we saw no adverse events in the canine studies.
Wonderful. And you said that the felines, it was approved for felines 9 years ago?
Yes.
And when was it approved for canines?
We got that approval in November of last year.
That was the one in November. I see. Okay, so you've been using it for cats for quite some time then.
Yes, yes.
Wonderful. So a lot of vets probably, know that it's out there. And if people go in and their animal's having trouble or is diagnosed with one of these conditions, if they mentioned that, it's probably known more for cats than for dogs, I guess.
That's correct. We do have hundreds of vets that are using it for cats who now we've made aware that it's approved for dogs suffering from moderate to severe osteoarthritis. And we're trying to expand that knowledge base to all of veterinarians across the country.
Oh, of course. Speaking of expanding, I know you touched just briefly on, continuing your research. Can you talk about maybe what's next, or do you guys have any things that you're working on right now?
Well, we are continuing the research and studies both in cats and dogs. We are planning a larger study in dogs with osteoarthritis, and we're really going to focus on how LTCI is dampening the immune-mediated process. We're going to work with a major veterinary school that has the capability to look at the immunological parameters that are involved in the disease and how LTCI is altering that. What we think is happening is once you arrest or down-regulate this immune-mediated process, we think the joint can heal. And that seems to be the evidence from the feedback in the field that these maintenance doses can be progressively stretched out to every 2 months, 3 months, 4 months. We have cats now that are getting maintenance doses every 6 months, and the dogs that are on treatment for osteoarthritis are out to 4-month maintenance doses. So again, this is suggestive that once the immune-mediated damage is slowed down or arrested, the joint can start to heal even in an older dog. And again, I've seen it in my own Rottweiler. He's out 4 months on his maintenance schedule now.
Wow. That's unbelievable. I mean, a lot of treatments, require, some require daily, but certainly not months out. So that's unbelievable.
No, it's been unbelievable to me. And of course, this is the only individual dog that I've seen. But
right.
We're getting feedback from the field that is confirming the study results.
Yeah, I mean, not only is it more convenient for the pet owner and certainly more comfortable for the dog that they're not having to do things, so frequently, but it must be cost saving as well if you're only having to do this every, like you said, 3, 4, maybe even every 6 months.
No, I think it's cost effective from that standpoint. And again, it's a painless subcutaneous injection, and it doesn't bother the dog at all. We've had no indication that the injections on a repeated basis cause any adverse events.
So when you begin the regimen, I guess, if your veterinarian's going to do that, do you start doing like weekly injections or daily injections?
Well, we have to recommend the regimen that we used in the study, in the rodent preclinical studies that are the bases for the approval. And that was a much more aggressive regimen. In those studies, we did 3 injections in each of the first 2 weeks and 2 injections in weeks 3 and 4. Now, in this next study, we're going to back off to the regimen that we have found to be effective in cats, and that's 3 injections in the first 2 weeks, and then monthly or every other month maintenance doses. Mm-hmm. Because the mechanism mechanism of action is the same. It's the increase in the number and function of precursors of cells that become regulatory cells. And so there's no reason to believe that the dosage recommendation that we have found to be effective in cats won't be the same in dogs.
Right.
We weren't sure of that when we did the initial experiments.
Oh, of course.
But we're confident enough that in this much larger study, we're going to use the 3-dose loading regimen in 2 weeks, and then the monthly or every other month maintenance doses.
Excellent. That's just unbelievable.
Because it is an alternative for dog owners and for veterinarians, especially in older dogs that may be intolerant of other treatments.
Certainly, yeah. And I'll be sure to link to your the t-cyte website as well, so that people can see the research that's done on there and the information there as well. I need to give a huge thank you to Dr. Beardsley for taking time out of his busy schedule to speak with me. That was such an eye-opening interview, and I learned so much from him, not only about t-cyte and the LTCI protein, but just about caring for your dogs in general and how they developed the product. So I'll be sure to keep that in the back of my mind if we have any issues with our dog. Those results are unbelievable. And do a little bit more research. I encourage you to jump on the website. That's link is going to be in our show notes on our website, which is theoryofpets.com. You can jump on there, and I linked to their site, and as he mentioned, there are tons of great PDFs and research. If it's something that you're interested in or something that you're thinking about for your dog, make sure you jump on there, do that research, read up about it, take it to your veterinarian, have a conversation with them, and see what they think about it. But there is just so much feedback coming from people who have tried this and positive things. And as Dr. Beardsley mentioned, the side effects are minimal to none. They haven't had any negative responses. So, of course, every dog's different, and who knows exactly how your dog is going to respond to a certain treatment. But it's definitely worth a look through and a read and a conversation with your vet. So that will be on there, as well as, of course, our show notes. And you can find all my past podcasts and show notes for those on there as well. And if you guys don't mind, if you could just jump on iTunes really quickly and give me a quick review, that would be super beneficial. The more the word spreads about the podcast and the more people that I reach, the easier it is for me to reach out to experts like Dr. Beardsley to have conversations with them. This week I am going to be speaking with the creator of Music for Dogs. It is a YouTube channel that, you guessed it, plays music for dogs. So I know it sounds pretty simple, but it's actually a very intricate process, and the feedback there for people who say that their music is helping their dogs with separation anxiety and things like that, different forms of stress and anxiety, is pretty amazing. So if you are interested in that, come back next week, and that's what we will be talking about. I hope you guys enjoyed this one, and don't forget to jump on iTunes and leave a quick review. I appreciate the listen, and I will see you guys next week.